Dignity Health St. Mary Medical Center is conveniently located near downtown Long Beach, the Port of Long Beach, and the Long Beach Airport. Our hospital was founded by the Sisters of Charity of the Incarnate Word for almost 100 years, and we still make sure that we provide high quality care in a compassionate environment to a very diverse community. We are extremely proud of our internal medicine residency program, and we're proud to be a teaching facility.
We try to give as much supplemental education as we can. We do this through a series of workshops. We have on our 4th floor a simulation lab in which there's multiple mannequins and we're allowed to run mock code blues. We also on the 2nd floor near the ICU have a procedures room in which the residents can practice intubations, central lines, A lines, LPs. It's really helpful in which we can repeat and retrain so that the residents can really refine their skills.
We have 2 mobile point-of-care ultrasound machines. We have a Sonosite as well as a GE Logic Q. There's also Sonosite ultrasound machines in the ED. We just recently purchased a couple of butterfly probes that'll sync with the resident-issued iPads.
Our strength is our critical care. We have one of the busiest ICUs around, and one of its features is a mixed ICU with typical internal medicine, respiratory patients, as well as cardiology, as well as neuro critical care and surgical critical care trauma. So in terms of getting a broad experience taking care of very sick patients, we are very strong in that.
We have a library with an in-person librarian. It's really useful when we need to do research projects or presentations. Rounding experience includes 2 components. We'll have tableside rounds in which we'll sit down in front of a computer with our attending, and then we'll discuss the cases and we'll review them with the computer in front of us. And then the second type of rounds is when we have bedside rounds in which we have a workstation on wheels. That computer goes with us from patient room to patient room. We can pull up images, we can pull up labs, and it really complements and supplements that learning experience.
For the table rounds with the attending, all of the residents get an iPad to use while they're here at St. Mary's, so you can put in real-time orders as your attending is giving you instructions.
Every patient room is a private room, so you don't have to worry about overcrowding, and it's a very nice patient to nurse ratio. So if you need something done, if you need to get a hold of a nurse, it's relatively very easy. And the patients tend to really like their rooms. They have their own bed, they have their own bathroom, they tend to have their own TV and a window with a nice view.
All of the GME faculty are all along one corridor, so it's easy for the house staff when they're coming to their afternoon didactic can pop in and see any of the faculty, their advisors, program leadership.
One of the perks of going to St. Mary's is that you get 3 meals provided per day, a $9 budget per meal, and it's not the same food all the time.
There's a salad bar as well as a grill for made-to-order items. All of the call rooms have a computer, TV, telephone, and access to a bathroom and shower.
It's really easy to find a parking spot so you don't have to drive around. And then if you have an electric car, there's also free electric charging stations. And the parking lot is literally less than 2-minute walk from the entrance to the hospital. So it really cuts down on your commute.
Now you have gotten a sense of what our program is. Ultimately, it's not about the program or the candidate alone. It is about the correct fit for each. Thank you very much for your interest in St. Mary Medical Center.